Morning, everyone. My name is Zhuo Huang from School of Pharmaceutical Sciences in Peking University. So today I'm going to show you some results from our lab. So a mutation, gain-of-function mutation of KCNT1 can cause epilepsy, and almost all of KCNT1 mutation are gain-of-function. So we are interested. One thing is quinidine can block this KCNT1 channels and is useful for some of the patients. But the question is, in vitro, normally the quinidine has IC50 around 100 to 300 micromolar to block KCNT1 channels. And in vivo, normally in the blood concentration is about 3 to 11 micromolar for the patient to treat epilepsy. But considering the blood-barrier permeability, so the quinidine concentration in the central nervous system are around 1 to 3 micromolar. There is a big difference in vivo and in vitro. So we think because the KCNT1 is a sodium-activated potassium channel, so we think maybe the interaction between the sodium channel and the KCNT1 channels may play a role for the quinidine inhibition. So we use the HEK cells to express the KCNT1 channels alone, so we can get this quinidine IC50 about 100 micromolar, which is consistent with the previous study. And when co-expressing the KCNT1 channels with other sodium channels, we found when co-expressing KCNT1 with NAB 1.6, so voltage-gated sodium channels can increase the IC50 about 100-fold, which are around 1 micromolar. Then we do this immunofluorescence experiment. We can see there is hold on. We can see the KCNT1 channels and the NAB 1.6 channels are co-localized in the axon initial segment, and also there are interaction each other. So when we knock out the NAB 1.6 channel, there's a loss of sensitivity for quinidine to KCNT1 channels. So there is a two type of sodium influx through this NAB 1.6 sodium channels. When we hold, one of them is transient influx of sodium channels through the 1.6. Another one is persistent influx of sodium ions. So when we're holding the cells at -40, so we can completely we can abolish this quinidine sensitivity to block KCNT1 channels. When we use the riluzole to block a persistent influx of sodium current, so there's no effect for the quinidine sensitivity. So we also we want to know why other sodium channels has no effect on the quinidine sensitivity to block KCNT1 channels. So we keep the membrane domain for the NAB 1.6 and put this NAB 1.6 N terminals and the C terminals into this voltage-gated sodium channels, so which can mimic this effect of NAB 1.6 to facilitate the block. So because there is a physical interaction between the NAB 1.6 channels and the KCNT1 channels, so we also resolve this structure of two channels. We want to know the interaction and how they work together. So we're still working on this. So basically, this is the model. Two channels are co-localized in the axon initial segment. So there are two strategies maybe can treat this disease. One is that we can develop a peptide blocking the interaction between the two channels, which can reduce the current of these select channels. So another way, we think this complex might be a good idea for the drug screening. So might be a better model for the expressing the select channel or KCNT1 channels alone. So another work, so we're collaborating with the Yu Jiang in the First Hospital of Peking University, also the Malashaka in UCL. So we identified a new mutation for the KCNT1 channels, and we characterize there is a gain of function of this mutation. Also, the increasing of current is due to the increasing in the open probability of the channel. We also do screening for the existing drugs, and all of them has no effect to blocking this KCNT1 current. We found this new drug might be useful, can block these KCNT1 channels, which is carvedilol, which has been used in the clinic for hypertension. So we found that this carvedilol has a better IC50 to block KCNT1 channel with IC50 about 1.06 micromolar. And carvedilol can significantly reduce the open probability for the KCNT1 channels and has no effect for the single channel open probability. For the single channel amplitude. So we also test the carvedilol on the mutant mice, so there can significantly reduce the seizure susceptibility. So last part of my work is about this. We developed some small molecules to block this KCNT1 current. So which is collaborating with Liangren Zhang in Peking University. So we do this virtual screening for these channels and found some active compounds to can block these channels. So basically, we can see this compound Z05 can block this current significantly with IC50 about 3.4 micromolar, and which it has a more potent for the mutant channel, which is about 0.4 micromolar. And this compound has no effect for other channels, for example, the 1.2, 1.5, and the BK channels, and has a little bit effect on the PERK channels with IC50 about 77 micromolar. So in conclusion, we found the KCNT1 and colocalized with NV1.6 sodium channels in the axon issue segment. The co-expression of two channels and enhance the quinidine sensitivity to SLAC. Also, we think the transient influx of sodium ions is more important for the quinidine sensitivity. We think this complex NV1.6 and KCNT1 might be useful for the drug screening. Also, carvedilol might be potent drug for treat this KCNT1 related epilepsy. And last one, we found this small molecules 005. It has a better pharmacological profile and the brain penetration, also oral bioavailability. So lastly, I would like to thank my team and the collaborators. Thank you very much.
Thank you so much, Dr. Huang. This is great work. David, I see that you have a question. Let's do just one question and then we're gonna move on as well. And again, everyone, there'll be time at the end. So write your questions in the chat or hold on to them. Go ahead, David.
Yeah, this is really great work, and I'm so glad you're doing this. I was just curious about the compounds that you're screening. Are these compounds that are already approved for other indications, or what's your compound library consist of?
I mean, which way? It's carvedilol or the?
No, sorry, like Z05.
05. It's a new compound we screened in our compound library.
But are these compounds that are already approved for other things, or where are you getting your
no.
compound? Okay, gotcha.
No. Okay.
Good question.